Hello everyone, my name is Dr. Bernaya. Today we will discuss Chapter 3, Applying a Nursing Model for Promotion of Wellness in Older Adults. Myth about aging is a foundation of ageism. The role of a registered nurse is to dispel this myth and educate public about health conditions of geriatric population and their needs. In majority of cases, older adults might be seen as frail, confused, depressed, or dependent. But we have to differentiate age-related expected risk factors that are related to age-related changes or different health conditions that predispose a patient to certain loss of function status. Theories regarding aging attempt to explain why and how people age. As well, theories are helpful for explaining prediction, description, and prescribing of nursing care. Theories also attempt to explain relationship among core concepts such as the patient, nursing, health, and environment. It's what we will discuss today. As well as help to guide nursing care that is special for patients' care and patient wellness. Functional consequences theory is the theory that we will discuss today and apply to a specific patient condition. This theory addresses two questions. The first one is what is unique about promoting wellness for older adults? And the second question, how can nurses address these unique wellness needs of older adults? When we have a lecture in class, when I interact with students and have this opportunity, so when the lecture is not recorded, I present this diagram and it gives students an opportunity to apply a functional consequences theory in practice. For example, we have a patient who is older than 65 years old. And during our nursing assessment, we may identify several factors of health conditions that is pertinent to this specific patient. It might be deterioration in hearing acuity, visual acuity, osteoarthritis, for example. And I give an opportunity to students to select any health-related problem, age-related health-related problem to practice. Let's say we will discuss decline in hearing acuity. What we can expect with what happens with age? We can expect that presbycusis can develop. What are the risk factors? What do you think? It can be nephrotoxic drugs that a person received during his or her lifetime. Unhealthy work environment without protective equipment also can be. It can be trauma, different ear infection that can happen during earlier years. And the most simplest cause in decline in hearing acuity can be cerebral function that is easiest to deal with. Now let's take a look on age-related changes. A person who does not hear well might have less contact with other people, stay at home more, but on a physiological level there is more potential about using other senses for communication, such as vision or writing, for example. What are negative functional consequences? The decline in hearing acuity can predispose to decline in communication, in person isolation, and as well as quality of life that declines. Risk factors we discussed already today. What are the nursing interventions? First of all nursing intervention starts with assessment. So you have to do subjective and objective assessment of this person to identify if there are any factors that can be managed, and you will develop a plan of care. For example, during your health assessment and head assessment, you will find out that the person might have cerebral, let's say. As I told, this is the easiest solution to manage, and you can refer a patient the patient to a healthcare provider like an ENT who can do ear lavage and prescribe ear drops to soften the cerumen and do ear lavage. So this will be your plan. And the wellness outcome, for example, either if it is cerumen infection, it is cleaned and the patient might regain his hearing acuity well. If there is other problems, audiologist does assessment and the patient might be eligible for hearing aid. Again, the whole process of application and eligibility is taken into consideration, but from the nurse's standpoint, the patient needs to be referred as appropriate. If a patient has hearing aid, teach how to use it appropriately. So this is the application of functional consequences theory. Basic premises of the functional consequences theory. Remember that nursing, in comparison to other specialties like medical doctor, is very holistic in nature. You take into consideration patient as a whole, including body, mind, and spirit. I told before a previous lecture that the exception is when the patient has an emergency life-threatening, mind and spirit is not pertinent. In this case, you're taking care of a body needs. So your goal is to alleviate and modify environment and negative functional consequences so you can promote positive functional consequences and address risk factors. Your main goal is positive wellness outcomes that can help an individual to function on his or her highest level available. Let's think about functional consequences. They can be negative and positive. In majority of cases, these are negative functional consequences, such as decline in hearing, in vision, in mobility. But let's think what, on the other hand, advanced age will bring positively. Let's think with whom you usually go for an advice. Sometimes you go to your grandparents and ask what his or her opinion. So this person is more smart and wisdom is evident due to life experience. Think about other positive functional consequences besides wisdom that can come to your mind. After the lecture is over, think about it. Give yourself 5 to 10 minutes to think about what else might exist. Your goal as a registered nurse to do functional assessment, to identify the ability to perform, for example, activity of daily living. While reviewing your care plans, you attempted to write down all behaviors, all problems that the person has, but do one at a time, especially when you're learning how to do functional care plan. An assessment of any care plan. You have one problem, do a care plan, how you will address it. But if you have a patient and you write a problem with insomnia and you discuss in your intervention part only about mobility problem or problems or transfer problems, it's not the consistency in your care plan. Your care plan is supposed to be read from the beginning to the end and from the end to the beginning, talking about the same issues that the person has. If you have more than one functional limitation that you can see, you have to address everything in your care plan, as long as you include it in your care plan. So in comparison to functional assessment, functional consequences theory is more broad in nature, and yet it helps not only to distinguish age-related changes that increase a person's vulnerability, but can also help to plan the care in the future. It helps you to address negative consequences and work on promotion of positive wellness outcome. Let's take a look at this picture. Age-related changes. They are inevitable and progressive. Irreversible changes. Let's take a look at this picture. So this person has ectropion and of eyelids. He also has aqueous semalis. What are these conditions? Ectropion is when the eyelid is everted. Entropion is the eyelid is inverted, as you can see here. Both conditions are very irritating because your patient will rub the eye very vigorously. In this case, there is a dryness of the lid, and it happens due to weakness of muscles. But if you take a look carefully here, you will see that the lower lid inverts inside. When an eyelash comes into your eye, it's very irritating until you remove it, right? But in this case, these eyelids are inside of the eye and it's very irritating. What can be done? From your standpoint, first of all, you refer a patient to an ophthalmologist. In this case, only those who are eligible. Eligible if the patient is not so demented, they do surgery. One of my patients had this kind of condition. He was not eligible because he was so demented that he was able to damage the stitches unintentionally. So the ophthalmologist decided not to do any surgery, and they applied moisturizing creams to the eyelid to keep him comfortable. And in this case, Botox injections are given every 3 months. It helps a little bit with this condition, but also lubricating eye drops helpful. Aqueous semalis is accumulation of phospholipids. Sometimes you may see a little patient with this ring around their ear iris, but with age it might be not so dangerous. But if you see a younger individual with this ring, I would really concern about his or her cholesterol level. This concludes the first part of chapter 3. I will report chapter 2, part 2 and so on.